To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Hi, my name is Wachiame Kwame, the rap doctor. Coronavirus is a stubborn one, and because of this small virus, the whole world is on lockdown. But hey, hope is not lost. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctors. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they will give you an amazing discount. Mobile doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile doctors, the doctors in your home.
It no be wanna photo. Say we dey fight corona.
My guys, I want to discuss some 7 things where people they talk about corona plus you.
You put the worry. You don't know say corona really kill black people.
Make you no make anybody lie you. Corona no dislike give anybody crap. True say it start for China, but right here, it catch everywhere where they fit kill anybody, especially people where they get some other sickness. For places like Yankee, corona they kill black people pass. Yeah, Charlie. Some people say they talk say China people with shada do or it be 5G self where they cause them. But shine your eye, it no be anybody do we 5G to no go fit cause the sickness. The 5G self, it dey like the 4G way we all they take browse righty. It just be upgrade. People too they talk say if you get corona we chop plain, take garlic, onion, ginger and lime, the sickness go. But this one too be lie. This thing's good for the body, mom, but I don't know if it prevent or cure corona.
So what about Sobolo?
Me self, I dey like Sobolo, but into no they do corona nothing.
Appeal to
Corona mainly they attack the lungs, so appeal no go fit do am nothing. The truth be say, people wey dem dey booze, corona they feel worried them, papa. People too they talk say if you cut onions put your room, corona no go come there. But corona no they like mosquito, where go fit kill am plus coil.
then how we go feel protect on our body?
Corona they spread where more people self get, where they no know. So Charlie, if you no get anywhere important go, make you dey house. But if you really for come out, then you for wear mask, then stay at least 2 meters away from other people. If you dey wash your hands, then use hand sanitizer more times. But I beg, make you no drink am. If you dey call for sneeze too, do for your elbow inside. Take some bleach to clean surfaces where they touch. But this no be for your body. Finally, if you feel say you get corona, make you go chop for one corner so say no go spread am. If you get plenty rest, then drink more fluids. But if you dey make worse, then for call the emergency numbers. Charlie, this be all for today. But if I hear any other thing, I will come back to talk about them. For now, you for make sure say we go protect we, our family, our friends, then everybody from corona. We all for play one part, so say we no go increase the pressure where it dey on a healthcare system and on a healthcare professionals them at all.
But we for take responsibility and keep fighting with positivity.
Good morning, good afternoon, good evening, wherever you are in the world. Welcome to the health segment on Trend Africa TV. I am your host, Empress MAWUSI. Today is another beautiful Thursday. It's so beautiful outside. Today is June 18, 2020, and it's about 6:35 p.m. right now, Central Time. Today we are going to be talking. We are still on the topic of COVID-19 and the way forward. We are continuing to talk about ways to keep safe and keep our families and friends safe. I would like to use this opportunity right now to plead with our viewers, everyone joining us right now. Could you please share the feed? Invite your friends and family. It has come to our notice that I'm not going to be discouraged. We are going to continue educating the public. And That is why I am appealing to you and I'm pleading with everyone right now on the feed. Please, please, please share the feed. We are going to take a little break to give everyone the opportunity to join the live feed. We would like to get our numbers up and we will take things from there. So stay tuned. Don't touch that dial. We'll be right back.
Bang, bang, bang. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, yeah, virus. Echewa, we go lost.
Purchase your track now.
Wash your hand daily with running water and don't stop. Keep away from non-farm meetings and do something, bro. Pray for your enemy, pray for your family, pray for your country, yeah. Don't forget to keep clean with hand sanitizer. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, yeah, virus. Echewa, we go lost. China, Japan, man down. Italy, UK, man down. United States locked down. What now? Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, yeah, virus. Echewa, we go lost. Pause a minute for today. Wash your hand clean and pray. Global epidemic day. Corona, people dying every day. Corona, it be virus. Mania, funny serious. Corona, yeah, virus. Echewa, we go lost.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us at Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Hello again, everyone. This is Empress MAWUSI on the health segment on Trend Africa TV. Right now, I am going to be introducing our special guest and our regular panel of professionals. And I'm going to start by no one other than our beautiful Mrs. EUNICE CROMWELL. Mrs. EUNICE CROMWELL doesn't need any more introduction, but I am so proud of her that I'm going to go ahead and introduce her anyway. So Mrs. EUNICE CROMWELL is a family nurse practitioner who provides continuing and comprehensive healthcare for all ages and genders while emphasizing on health promotion and prevention. Show manager of the Ghana National Council. Mrs. EUNICE CROMWELL, welcome to the show. Secondly, we have Dr. OFORI, who is an assistant professor of the pharmaceutical sciences at the Chicago State College Pharmacy. He is a professional pharmacist and a researcher in mental health and neuropsychiatry. Dr. OFORI is not here right now. I guess you'll be joining us later. However, just so you know, in there somewhere. And last but not the least, we have Joining us from all the way Ghana is Dr. John Akwe AWAH, who is a diplomat of the American Board of Internal Medicines. He was trained at the University of Ghana Medical School and is a postgraduate in the UK and USA, respectively. Dr. Awa is experienced in both academic medicine and private practice. Dr. Awa, welcome to the show. Dr. Awa, are you there?
Thank you very much for inviting me.
You're welcome. You're welcome. So viewers,
I'm here. Can you hear me?
We have Dr. Awa is very, very experienced and he's a professional. So you need to stay tuned. He's got a lot of good information for us, very lucrative information for us. But before we go on with the interview, we would now welcome Mrs. EUNICE CROMWELL to give us updates on COVID-19 and the way forward. EUNICE, over to you.
Thank you. Good evening once again to everyone. Right now we are pretty much, I've noticed that cases are really coming down in Chicago. I spoke to a friend who works at Swedish Covenant Hospital today, and he told me that they've had a decrease in death in the hospital. And so what we have been seeing, unfortunately, is when the protesters were happening and everything, there was fear that there were going to be more cases. I have seen online that places like Florida, there was a certain pocket where they were that the people who were protesting all ended up getting COVID-19. But for the most part, people have been doing very well in Chicago with the social distancing, with just following the rules, washing your hands, using hand sanitizers. So things are on, on the better side. We must still remember that there is no treatment for coronavirus. So we need to make sure that we are taking strict precautions, making sure that we are washing our hands for at least 20 seconds with antibacterial soap, and then we are using hand sanitizer in between. We all remember that after you've used your hand sanitizer 3 times, you need to now get to soap and running water to wash your hands so you don't have any bacteria on your hands. What else is there? Make sure that you're always wearing your mask. There's been lots of controversies about masks because so many different people are making masks. But remember that if you're using just a normal surgical mask, if it were to get damp or moist, you need to remove it. Some of the ones who are making masks, like the cloth masks that we see, make sure that you're also washing your mask. They're not meant to just put in your purse and keep on using it without washing it. So make sure you're washing it with mild soap. What I've been seeing in practice is that some people have been washing it with very harsh detergent and they're getting allergic reactions around their face. So my recommendation would be just to use like mild Dove soap. You don't need to put it in the dryer to avoid it shrinking. You can just hang dry it in your bathroom. So that is what I have for you all. I hope and pray that everyone is staying safe. We've been doing very well. I know it's hard being inside with the weather changing, but we should still hold on tight and hopefully we'll be able to get through this.
The WHO came up with a statement, a controversial statement that whilst you could contract the virus and not be showing any symptoms, it is very rare for you not to show symptoms when you have the virus. And right now, the CDC, it's like they are contradicting what the CDC put out there. So what is your take on that?
You know what? I would say in both ways. I've had a few patients who were not feeling well, and I was 100% sure that it was just like a flu or upper respiratory infection. But upon them still not feeling well and they got tested, they came back with COVID-19. I've also seen people who have not had any symptoms whatsoever, and they've been tested positive for COVID-19. So I will say that by this being a novel virus and we don't really know a lot about it, and every day we are learning about it, and the scientists and the doctors are tirelessly, trying to make us understand it. I just want to remind everyone that everyone's body is going to react to things differently. Even when you think about a flu or a common cold, if I get a cold, I may be okay and just have a few sniffles, but somebody may be very almost deadly sick. and have to be inside of a hospital even for a common cold. So I think that statement can be in both ways. We don't know what the virus looks like on everyone. If you can remember in the beginning when we first started having this conversation, there were tons of people on ventilators, and we were watching people in China just drop dead in the middle of the street. Right now, what we're seeing in terms of COVID, it looks a lot different because people are now at home, recuperating at home. If you look at the way people even are walking around, like the celebrities, and they're like, I have COVID, they have their mask on. So it definitely presents clinically different for everyone. So that's why we need to always remember that this virus is real. We shouldn't take it we shouldn't take advantage of it, and we should just look at everyone like they could potentially be infected and really protect ourselves.
So how is the curve looking now?
Yeah, I think the curve is going down. When I was watching CNN and I checked on CDC today, they said it's going down a little bit. But of course, like I said, with the protesters, it's kind of, it kind of grew a little bit, which is to be expected because people really came out to support the cause, which I agree with 100%. I was just telling everyone that I want to protest, but I want to do it socially distancing. I want to be a little bit back, and I want to really, really support, so we can get things together. So some people kind of lost track of that, and it was an emotional time for everyone. And there were a few people who actually died after protesting. So we do know this virus is still on the rampage. So again, I'll just encourage people that even though we may be seeing a trickle of it down, in certain countries, and we'll definitely talk to Dr. AWAH about this, things are growing at a massive rate. So it is still an issue, a global issue.
Presently, 75% of ICU beds in Florida has been occupied because there's been a spike in Florida. Should we be worried that we might be seeing a domino effect coming to Illinois? And I have also heard that Illinois is one of the states that have been able to control the virus. Should we be concerned at this time?
You know what? I think because people can travel, we should definitely be concerned. I think that anything that is happening in any other state, you have to look at your own state and wonder if that could possibly happen. And so I would say right now, with things are opening, we're like in phase 3 now. According to the governor, you can go out to a restaurant, but an outdoor restaurant. So I feel like Illinois has done everything in their power to keep us very safe, but it's up to us to continue doing those things, not to make ourselves sick. I saw, and I'm not sure which state this was in, but someone went out for dinner with 15 people, and all 15 of them ended up getting COVID-19. They said that they were reckless, and I'm not too sure. I read a lot in the morning when I wake. I'm an early bird. When I wake up in the morning, I read a couple articles, and I thought to myself, how could 15 people at one outside restaurant end up getting COVID? So it lets you know that they were probably there with no mask. They're probably too close and closed and stuff. And so definitely what is happening in Florida, we are not exempt from it, and we should just really still take precautions.
So don't you think this protest going on with George Floyd has taken the attention away from the severity of COVID? Are people just saying, you know what, I don't care anymore, come what may?
I think people are tired of COVID anyway. I think it was one of those things that came out and it was everywhere. And when you look at your WhatsApp, all the messages you were getting. So I think people were tired. And I would say that the attention shift to George Floyd was definitely it was well needed. Definitely we needed to shine light on that unfortunate situation. And as always, I'm always praying for the family and our own community that we can all heal from it and move forward. But definitely, I think people in general were so tired of COVID, and this was a reason to be outside for a good cause, and people definitely took advantage of that.
Okay. Thank you, Mrs. EUNICE CROMWELL, my co-host. I know you're going to be hanging in there. We are co-hosting or co-interviewing Dr. AWAH. So can we please bring Dr. AWAH in? Whilst Dr. AWAH is joining us, I would like to use this opportunity to thank our sponsors, which are Omama TV, Holiday Africa Ghana, Powerhouse Media and Restaurant, Akese Skyline Designs, Medus Designs, and Odinuhun Designs. Dr. AWAH, thanks for joining us. And I know it's very late in Ghana now, but you are up to join us. Dr. OFORI, are you also there?
Yes, I'm here. Yeah. I'm here. Yes.
Oh, okay.
All right.
Welcome everyone to the show.
Thank you.
That's AWAH. Could you please tell us? I know
Thank
I just
you. Thank you very
told
much.
us
Thank
a
you.
little bit about you, but could you please tell us a little bit more about you and what it is you do? Over to you, Doctor.
Okay, I'm a physician specialist. I trained in Kolebu in Ghana, and I did my postgraduate in the United Kingdom and also in Chicago. I worked as an internist in Chicago for 20 years. I've just relocated to Ghana, and I've set up a mobile doctor service in Ghana. So currently, I am working in Ghana full time, mobile, and making doing house calls and trying to train doctors here to do house calls. We're trying to fill the gap, of healthcare delivery in Ghana. There are lots of doctors who are looking for positions, place to work, but there aren't many hospitals for them to work. So there are a lot of unemployed doctors. So I'm trying to use those doctors to fill the gap and take them to patients home to deliver medical care. So I'm doing in Ghana.
Oh, okay. Thank you, Dr. Awa. I cannot begin to ask you how it's going because I know our streets are not, some of our streets are not labeled. We're talking about bad roads, and I can't even begin to ask you how it's going for you. So I'm going to, give Mrs. Eunice Cromwell the opportunity to ask a couple of questions too.
Thank you. Dr. Awa, we would all like to know, how are people receiving the home visiting idea in Ghana? Because I know that it's something new for them. So how do you think that they're receiving it?
Oh, a lot of people are interested and excited about the service. Because these days, because of coronavirus, most of the hospitals and clinics are empty. And you wonder, where are they getting their healthcare service? And this is where we come in. Unfortunately, we just started this house call 3 months ago, and not many people know about us. And those who know about us, they feel this is a dream come true. So we are actually trying to fill um, the area where people are trying to get healthcare delivery in Ghana, and it's catching up. We're actually getting traction. People are very happy with our service, and they want more. We actually deliver medication to your home. We bring the lab to your home, and we do everything at home. So it's a service that people are really appreciative, and we've seen so many wonderful cases, that will help to alleviate the pain and suffering at home. So yeah, it's coming along well.
And do you think that it's going to encourage people to be able to keep up with their primary, like preventative medicine? I know that a lot of times, like here, how we have like a schedule, how we are trying to put people to make sure we're checking their labs and doing all the things for preventative medicine. But in Ghana, sometimes I feel like there's no set schedule. And because of people really not wanting to go to the hospital, nobody really checks those things. So do you feel like having this mobile service is going to allow people to stay focused on preventative medicine and taking better care of themselves?
Now, preventive medicine does not exist in Ghana, unfortunately. People wait till they are sick before they go to the hospital or clinic. It doesn't exist. So this is one of the areas I'm trying to focus on, to tell people you don't have to be sick to see us. So it's a huge education, and it has to start from the top. It has to start from the government level. It has to start from policymakers. That you don't have to be sick to go and see a doctor. So most of the time, every time we see anybody, are very sick. They got infections, they got strokes, and it's like terminal stages of disease process we are seeing. So preventive care does not exist in Ghana.
Have you seen a lot of COVID-19 cases that you've been treating inside the home?
I would say In my personal practice, not many. Maybe I can count on one hand about 5, 6 that I've seen that I think they are COVID patients. No, we don't. Now, I'll tell you about COVID in Ghana. It's interesting because even though we are testing, I don't think we are testing enough. And fortunately, COVID is not as deadly disease in Ghana as in your part of the world. So people are not dying from COVID. They're just taking it as a flu, a type of flu. So that is the fortunate thing about it, And I think there are various reasons why this is occurring. So we're not seeing, too many COVID patients in Ghana. So far, we have about 13,000, cases that have been identified. I know there are a lot more in the community. Fortunately, the death rate is very, very minimal. It's about 0.5% of people are dying from COVID. So it's not a deadly disease in Ghana.
Dr. Ofori, do you have any questions for Dr. AWAH?
Oh, yes. So, what do you think are some of the reasons that account for the low, I would say, morbidity rate with the COVID? What could be the contributing factor? Because some people, and I've heard a lot of myths about the fact that because we are Africans, our skin is tough and we have melanin and a whole lot of myths. Do you hear some of these things? Do you agree? What are your sentiments on that? Yeah.
Yeah, I will agree to some extent, and I'll explain. First of all, we know COVID affects the population that is aged 65 and above more than the younger population. And if you look at the population pyramid of Ghana, 65 and above, percentage of those who are 65 and above is less than 3%, right? So right from the word go, we don't have enough people in Ghana who are 65 and above, right? And those are the group that are high risk. We don't have enough of them. And it's because, as I mentioned earlier, there's no primary care in Ghana. So most people die young, and therefore our population is young population in Ghana. So that is number one. Number two is I believe the immune system of Ghanaians, not black people, but Ghanaians, is already on alert because there are so many other infectious diseases in Ghana that we are fighting every day. And therefore, our immune system is ready to attack any viruses that get into our body. For example, you have seasonal flu in United States or Europe, right? And it's killing people. You hardly, during those time of flu, you hardly see anybody in Ghana with the flu. It comes when people shake it off, right? So we don't see that many, such virus infection in Ghana because we are fighting it, and I'm thinking our immune system is stronger. It's Africa, it's Ghanaians, not black people, right? Because no black people in the United States, they die also more in the United States, but because their immune system is not strong. But in Africans, in Ghana especially, we're not dying because we have strong immunity. Now, I also believe that, and this is my hypothesis, that perhaps the potency of the virus is not as bad as the same in the United States or Europe, so to speak. So for somehow the virus is not affecting us as we thought, right? I mean, if you look at our healthcare system in Ghana, it's not good, right? It's not good. So I'm happy that we are actually facing this virus with strength and it's not killing us in Ghana.
Dr. AWAH, I want to find out from you. which kind of people patronize your services, and how are they paying you? Is it a voluntary work, or how do you, how are people paying you? Is it insurance? What's going on?
So in Ghana, there is insurance system and also private paid. Currently, we are trying to get credentialed with the insurance companies so the insurance will pay us. But for now, people are paying out of pocket. And our target markets are people who unfortunately have enough money to pay for our services. So we are targeting people who feel they don't have enough time to go travel to the hospital, healthcare facility, and wait for a long time only to be seen for 10, 15 minutes. So our target population are the elites of Ghana. And that's what we're seeing. So our pricing, is a bit higher so that those who can afford it will call us. Eventually, things might change, but for now, this is our target market.
So do you have a whole team that you travel with, or you are the driver and you are the doctor too?
No, we have a driver that drives the doctors to the patient's home, and it's only one doctor and one driver. And then when the doctor goes to the patient's home, it's just like a consultation in the clinic. So in the privacy of your home or office, we do the consultation. And if we need to do any lab work, then we order the lab to come the following day and draw the sample, and the specimen is taken to the lab to be tested. If the medications have to be delivered to your house, we actually arrange for delivery of the medication to your home. Sometimes certain tests like CT scans, mammograms, we cannot do it at home. So we give you a special service. We provide a driver that picks you up from home and takes you to the center for the test, and we bring you back home. So we make it easy for you, and we try to make it as simple for the patient as possible.
So do you have how many doctors make your team? How many doctors do you have on call?
Well, I've actually employed 17 doctors.
Wow.
And as I said, there are so many doctors looking for a job in Ghana. So we don't have enough patients for everybody yet, but they are all in line to start working. And once we get busy, then we call them to come and see our patients. So we have 17 doctors on standby. We have dietitians on standby. We have midwives on standby. We have nurses. We have physiotherapists. We have massage therapists. We have all that. Everybody is on standby. So we get in, we are covering the whole Ghana, right? So we have a lot of staff that, that will come in once we are busy.
So do you take emergency cases too, and how soon can you get to your patients, putting into consideration the amount of time you have to spend in Ghana traffic? Because when I went to Ghana, it took me 3 hours just to go from my house to maybe Circle. How long does it take you to get to your patients, and if there's an emergency, how soon can you get to them?
We try and see the patient within 24 hours. Usually within 12 hours, we can see you. The traffic is not as bad. However, in Chicago, I used to see about 20 patients a day. I cannot do that in Ghana because traffic constraints. So yes, traffic is here, but I don't think that's hindering the rapidity with which we see the patients.
Okay, viewers, we will take a little break right now, and we'll be right back. Don't touch that dial.
Hi, my name is Ochiame Kwame, the rap doctor. Coronavirus is a stubborn one, and because of this small virus, the whole world is on lockdown. But hey, hope is not lost. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctors. They will send a doctor to your home, send a fleb to come and take your blood sample,
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they'll give you an amazing discount. Mobile Doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net.
My guys, I want to discuss some 7 things where people they talk about Corona plus you.
You put the worry. You don't know say Corona really kill black people.
Make you no make anybody lie you. Corona no dislike give anybody crap. True say it start for China, but right there, it catch everywhere where they fit kill anybody, especially people where they get some other sickness. For places like Yankee, Corona they kill black people pass. Yeah, Charlie. Some people say they talk say China people with shada do am, or it be 5G self where they cause them. But shine your eye, it no be anybody do am. Where 5G to no go fit cause the sickness. The 5G self, it dey like the 4G way we all they take browse righty. It just be upgrade. People too they talk say if you get Corona with chop plain, take garlic, onion, ginger and lime, the sickness go. But this one too be lie. This thing's good for the body, mom, but I don't know if it prevent or cure Corona.
So what about Sobolo?
Me self, I dey like Sobolo, but into no they do Corona nothing.
Appeal to
Corona mainly they attack the lungs, so appeal no go fit do am nothing. The truth be say, people wey dem dey booze, Corona they feel worried them papa. People too they talk say if you cut onions put your room, Corona no go come there. But Corona no they like mosquito, where go fit kill am plus coil.
then how we go feel protect on our body?
Corona they spread where more people self get, where they no know. So Charlie, if you no get anywhere important go, make you day house. But if you really for come out, then you for wear mask, then stay at least 2 meters away from other people. If they wash your hands, then use hand sanitizer more times. But I beg, make you no drink am. If you dey call for sneeze too, do for your elbow inside. Take some bleach to clean surfaces where they touch. But this will be for your body. Finally, if you feel say get Corona, make go chop for one corner, so say no go spread am. If you get plenty rest, then drink more fluids. But if you dey make worse, then for call the emergency numbers. Charlie, this be all for today. But if I hear any other thing, I will come back to talk about them. For now, we will make sure say we go protect we, one our family, one our friends, then everybody from Corona. We all for play one part, so say we no go increase the pressure where it dey on a healthcare system and on a healthcare professionals them at all.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Hello viewers and welcome to the health segment on Trend Africa TV. I am your host, EMPRESS MAWUSI. I am here with Mrs. EUNICE CROMWELL, Dr. OFORI, and Dr. AWAH. Dr. AWAH, moving forward, let's talk about COVID. What is going on in Ghana concerning COVID? Since this is mainly what this program is about, COVID on the ban on COVID in Ghana too early?
I missed your question the last time because the mic was I couldn't hear you. So can you repeat the last part of your question again?
I'm asking, was the ban on COVID lifted too early in Ghana?
Oh, initially I thought it was lifted too early. But I said, why not? Because it is not. First of all, it is more. It is we have a lot more in the population that's recorded at the moment.
Yeah, right.
And also, I am thinking that our system here. Well, first of all, it's not killing that many people, right? We're taking it as a type of flu, right? It's not killing that many people. Now, also, people, there's no many help for a lot of people to stay at home. So there's no social support, there's no governmental aid. So asking people to stay home for 4 weeks, 2 months, 3 months, you're going to be starving them. So I don't think it's practicable for us to continue the lockdown like other parts of the world, for instance, India, for lockdown for 4 months. We couldn't do that in Ghana. So I think it was okay to have been lifted at that time, and practice social distancing. And people are really very serious about the social distancing in most parts, even though the marketplaces, it's difficult to do social distancing. But the mask wearing, it's amazing how many people are wearing masks in Ghana. And I think that for us in Ghana, I think whatever the government has put in place is working, right? It's working. I know it's spreading, the numbers are going up, but not at the exponential level as in the other parts of the world. So lifting the ban was appropriate.
Dr. Ofori,
Yeah.
do you want to ask something?
Yeah, I wanted to ask a question about like stigma with COVID in Ghana. So I mean, I've had some people post up on social media about how people are stigmatized in Ghana because they have tested positive to COVID. What is your take on that?
Yes, unfortunately, you cannot, I don't say don't blame people, but people have their own ideas of how to stigmatize other people with disease processes. But it's all lack of education, right? And the government has tried to educate people, bringing people who have the COVID to the media and for them to tell their stories, that this is not a disease that is contagious, but it doesn't mean that when somebody has it, then you cannot be friends with them or see the same trouble with them and things like that. So it's been tackled, and I don't hear much about it these days, about the stigmatization of people. I think it's probably going away because a lot of healthcare professionals have had it and they've come out openly and said, I've got it, and nobody's shying them away. So I think it's working, right? Initially it was a problem, but people are realizing that, oh yeah. And right now, if you go to a hairdresser right now, a lot of people are really pretending as if COVID doesn't exist anymore. And because one of the
Dr. Awa, are you there? Okay, whilst Dr. Awa gets his technology sorted out, we will be talking to Dr. Ofori. Dr. Ofori, thanks for joining us again. So there's pressure on researchers to release the vaccine for coronavirus earlier than anticipated or earlier than planned. What is going on with the vaccine, and what are the backlogs of releasing a vaccine too early?
Yeah, so there's been a lot of treatment options explored since 6 months ago when COVID reared its ugly head. There has been a recent update on like one vaccine potentially from a company called Moderna. They have an mRNA vaccine, and I've explained this before, which is pretty much, it's never been used before. This will be the first time that they're ever going to use any form of RNA vaccine. There are about 3 stages of vaccine approval. The first 2 trials are still, the first one has finished, which showed some kind of promise. And because of that potential, people will develop antibodies against the COVID-19. Enough that it actually surpasses people that have actually recovered from the COVID-19. So that is very encouraging. So now the second stage is ongoing. There are other trials or other vaccines from J&J, Johnson and Johnson, that also has some potential. But for now, in the line of approval, I think Moderna's mRNA vaccine seems to be in the lead way, and the third stage or the phase 3 of the testing will begin in July. And this has been, if this one becomes successful, this will be the first time that we've been able to produce any form of vaccine within that short amount of time. Well, people are kind of worried about it because they think fast cook, fast kill, right? So we might have to do a lot of education about it. I've heard people talk about the fact that because it's made from RNA, it can actually change your genetic makeup, a whole lot of stuff about it. But I would say that mRNAs are not like that. They've been tried over the years, but there hasn't been any success with it. But so far, with this particular virus, it seems to be giving us some promising outcomes. So that is the only thing that I can say about vaccines potentially. There are about 125 clinical trials ongoing with vaccines, and the one that is really leading the headway is the one from Moderna.
Dr. AWAH, thank you. Dr. AWAH, you back?
I'm back. I'm using my phone now. My computer went banana. So.
Oh, actually, it looks like the phone looks better.
Yes, your phone looks better.
You're actually very handsome. I can see that.
Thank you very much.
Okay, Dr. AWAH, you were saying.
Okay. All right, cool. What was I saying?
So you were on the item of stigma, I think.
Oh, yes. So I just finished. I was saying that the stigma used to be present at the onset of the coronavirus outbreak, but for now, it is not as strong. So it is no more, people are no more being stigmatized in Ghana. It's not a very serious problem at the moment.
Dr. AWAH, I wanted to ask you about the emergency services in Ghana. I was reading an article and watched a documentary on YouTube, and it was a lady expressing how her nephew of 27-year-old passed away, and the hospital had no PPE. I believe it was at Kolobu Hospital, if I'm not mistaken.
Kolobu, yeah.
There was no PPE. She said that the doctors and the nurses treated her very bad. They didn't want to assess him. They just kind of looked at him and said his pupils were dilated, and they pronounced him dead before even really assessing him. But she explained that when she dialed 112 for the emergency services, they were asking her more questions about where she was located, and it took about 45 minutes for the ambulance to show up. How is the ambulance service there? Because I know we all watched when they all bought the new ambulances, and I was under the impression that with every region having an ambulance, it would be better care for the people in the community.
Even though they portrayed so many ambulances, in Ghana, it's not many. It's not enough for the country. I mean, these were distributed to all the regions in Ghana. And I don't think it's enough. And also, the average person doesn't know what number to call for the ambulance service. So ask someone in the street, if you are sick, what number do you call for ambulance? They don't know. So that is there. We need education. And the streets are congested. For ambulance service to run properly, you need certain lanes for the ambulance. So if you be in traffic, the ambulance will be behind you. Nobody wants to give the ambulance anywhere to pass. So that's one thing. And the hospitals, the government hospitals are not geared towards emergency services, unfortunately. If you have an emergency in Ghana and you survive, good luck. It's scary to be sick in Ghana. So emergency service in Ghana, I am not happy with it. Right, I'm not happy with it. And some of the big hospitals, private hospitals, are set up for it, but not many people can afford it. So you end up sending patients to the main hospital like Kolebu and all some of the community hospitals, and the services there are not good. So yeah, ambulance is not enough, right? And then the roads are not meant for ambulance service in Ghana. Too much traffic, and not many people know about the ambulance service, the number to call. So that's what I can say about ambulance service in Ghana.
And Dr. Awa, I saw that on your services, if someone gets sick, you arrange for them to get to a hospital. Do you also help them arrange if they needed to have like surgery out of the country? Like if it was a true medical emergency that nobody could take care of it, would your company assist for them to get airlifted somewhere else?
We haven't had any. I shouldn't say that. I just had a patient who from New York, and he had cancer, and the family is trying to arrange for him to come to New York for therapy for treatment. So I was coordinating the air ambulance service from Florida. They arrived in Ghana, and I made all the arrangements for them to go to the hospital to take the patient. Unfortunately, the patient died the following day when they were here. So yeah. So anyway, I can arrange. I know I have connections in India, and it's expensive, right? But if the patient can afford it, I will assist in getting the patient to any foreign country that patient chooses to go. Yeah.
Okay, right now we're going to read some comments and acknowledge our viewers. I want to thank Senna Hetty, New Evelyn, Classic Adra, Mr. Johnny Woods. You are all watching. Ebo Dancing says congratulations. Ibrahim Muhammad watching live from Kumasi. And then Ibrahim Muhammad went on to say, a lot of Ghanaians still have doubts about COVID, and ironically, they always run away from washing their hands even when they visit various stops, shops, or places to buy. I've witnessed a lot, and it saddens my heart. I pray the education on the pandemic enters their brains well. Thank for all your good work. Thank you, Ibrahim, for the acknowledgement. Mr. John Latte Asem also is watching us. Ibrahim Muhammad is also asking, my question is, there have been a drug trending on social media some days now, TB dexamethasone. Please, is it efficacious or recommended to be used for treatment of COVID, or is it for prophylaxis? If yes, please, what's the dosage then? Thank you. Who wants to answer that, Dr. Awa or?
Yes. Dexamethasone is a medication that we already use to treat inflammatory conditions and asthma, arthritis. So we already use it, and the dose it comes in a pack. It comes in a dose pack, and I'm not sure exactly what the dose has been used for the research purposes, but it's for therapeutic purposes, not for preventive purposes. So if I need to use it, I'll have to find out what the dose they use for research, and I can work around the dose. I don't have the dose offhand that I can tell you on air, but I will have to just check and see what dose they use, and I'll use that same dose.
Yeah, I think they use about 6 milligrams. Yeah.
Right, I see. Okay.
Thank you, Ibrahim Muhammad. Please let us know if your question was answered. Mr. Pa Kwesi Sam, our original president of Ghana National Council, is also watching. Hi, Pa Kwesi. Johnny Woods is asking Dr. Awa, do you have a plan whereby people in the diaspora can pay for your services for their family in Ghana?
Yes, you can pay online, you can send mobile money, you can send us Visa payments. So there are many ways. What other ways we're going to pay? Mobile money, we accept it, and then you can send the money to your family, and then they can pay us here. So there are various ways, that you can pay us.
Thank you. Daniel Kwame is watching. Ibrahim Mohammed also asks, Dr. Wow, it's been realistic with regards. Dr. Wow is being realistic with regards to the emergency cases. Ha ha ha. Good luck indeed if you survive from an emergency case in Ghana. LOL. This is so true. Okay, so Dr. Awa, he was commenting on your you were talking about how the ambulances, how I mean they can't just so that's how what is the way forward for Ghana in terms of healthcare. We are 4 healthcare workers right now here on board. What can we do to help? I know recently that OFORI released a cartoon commercial where he made it very basic so that even the layman can understand what is going on. And I feel like that is a big step in bringing change to his country, Ghana. What is the way forward? What can we do to help our country?
I think that I'm pleased to be in Ghana, though. I've been here for almost 6 months now, and I'm pleased to be in the healthcare to make a change. There's a lot we can do in Ghana. The it has to be multi, focal. The health, the government has to come from the government level, educating people, and I think primary care is what I think will save us. And it has to be driven by a lot of advertising. That you don't have to wait to be sick to see a doctor. I've seen so many people who come in and they think they are well, and they are in kidney failure, they have stroke, and they are young. And you see that's why our mortality, our life expectancy in Ghana is only about 60, 65. Right, we die too soon. So for us in the diaspora, I believe that we can we can educate our families, to try and see a physician. Even they are well, they should see somebody. But when they are 40 plus, at least you have to see a doctor once or twice a year. Even for your blood pressure check, or even to go and say hi to the doctor. So we can be on our own to let our families start seeing somebody, at some point. And then maybe if we can lobby the government level to start educating people. Do mammogram? Have you had mammogram before? And then when I start mentioning this to patients, it's what's that? Have you had a colonoscopy before? What's that? Do I have to have it? Nobody told me about it, right? Nobody told me about it. So it's strange, in the doctors, they only see you for malaria and that's it, nothing, no further education to, oh, have you had this done? Have you mammogram done? Have you had this colonoscopy done? Nothing of that nature, And sometimes I believe it's a cost too, it's cost money for people to actually go and have procedures. So they look at the cost and they just settle for treatment for today, and when it comes tomorrow, they'll do it. So it should come from government level, and then if you can have free pap smear, free mammogram, free this, right? So it's a long way for us to go. Maybe we can use some of the oil money to set aside for just preventive care, right? So many ways we can tackle it. Yeah.
But that's wow. How can you cut through with a message like this to people who are believing the state of their healthcare is in the hands of the Lord? They go to church every day, they are praying, and I mean, you telling them they should have mammogram or colonoscopy after they have prayed and fasted and sowed seed. How are you going to cut across? Or should you collaborate with the pastors at this point? I think we should start collaborating with the pastors.
Yes.
In my opinion, what do you think?
Yes, the pastors are troublesome. They're troublesome. Troublesome. If we start from the pastor level, that will work. That will work because Ghanaians believe in they believe in they believe in their pastors. They believe in a disease process attributable to
Evil
somebody
spirits.
else causing
Yeah.
evil, yeah, causing the problem other than themselves, right? And until we tell them that no, your disease process is because of you, we can't change their habit. So the pastor level is great, but I think also maybe the schools, maybe our medical training itself, right, in Ghana, and also telling every patient you see, you must tell the patient that you must get this, and that done. Reinforce at the government level, advertising that, hey, you must get this done. And also how it's going to be paid for, right? Because that, just saying that you should do this doesn't mean they will do because they can't afford it. So perhaps, there should be some funding set aside for primary care. And that's the only way that we can get people to get these things done, right? So education and primary care and government level and everybody else trying to tell their family, that please get these things done. Yeah.
Right now, I would like to acknowledge Mr. Ben Bracco, the legendary musician. He's also watching us. Daniel Kwame is watching us. He says, "Nice job, Dada Love." And then John Latte Assem is asking, Dr. Awal, do you have a private quarantine center?
Now, the COVID uh, infection in Ghana is handled by the government. And the government has designated certain hospitals all over the country to deal with COVID patients. So if I find a COVID patient or I suspect that a patient may be COVID, then there's a hotline number that you call, and they will direct the patient on what to do, and they will come for the patient from the home and take the patient to that center, for treatment. So I personally, or the clinics, or the private hospitals in Ghana do not have any COVID wards. Everything is handled by the government.
By the government. Um,
Yeah.
Key Mama is also watching us. Thank you for joining us. Dr. Ofori, Eunice, do you have any more questions for Dr. Awa?
I have one question. I wanted to know what medications in Ghana are covered by the government. When I was there at the clinic, one of the supervisors told me that certain diseases like hypertension and diabetes, I think, their medications are covered. But as I've been partnering with this hospital, I send medications to them all the time, and they're always out of medicine. So exactly what medications are covered by the government in terms of care?
I don't usually see patients on government insurance, which is NHIA. I don't usually see those patients, but I heard that they don't cover many medications. They probably cover the simple things. But if you have to go for some diabetic medication, I'm sure they don't cover it. I don't have exactly the list, but there's a list by which they go when they go to see. When you have that insurance, then they can only prescribe within a certain um, list of medication. But I don't have it offhand. I don't know it.
Dr. Ofori, any questions?
Oh, yes. So, what is the potential pitfall of this kind of telemedicine or the new business that you're looking at in Ghana?
I think that's the way to go in Ghana, because
Okay.
first of all, and it's sad that you train so many doctors and then you can't find a place for them to practice. I mean, it's so heartbreaking, when there are unemployed doctors in Ghana. I just can't believe that there are so many unemployed doctors around looking for a job. It's pathetic. So I think that the tradition of a patient going to a hospital has to change, right? Because we can do a lot of the practice in the home of the patient. And all those doctors who are there looking for jobs, in the hospital, right, in the facility, they don't have to go to the facility. So I can employ most of them, right? And all they have to do is to go to the patient's home to see them. So our services, home doctor services has lots of potential, in Ghana. Unfortunately, not many people know about us yet. And our pricing is a bit high for many people because if we bring the price down, we will be inundated with so many patients, right? So we push the price up a bit, until say a time that we can afford to bring it down and cover everybody. So the potential, for our services is great in Ghana. It's amazing. We just have to make ourselves known.
Okay, viewers, let's take a little break and we'll be right back. Don't touch that down.
Hi, my name is Ochiame Kwame, the rap doctor. Coronavirus is a stubborn one, and because of this small virus, the whole world is on lockdown. But hey, hope is not lost. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctors. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they will give you an amazing discount. Mobile doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile doctor.
It's here for Mechiamo, God's afternoon. Yes, fellow Ghanaians, this is a public service announcement. No need to get excited. Your watch it stays the same. It's in the brown box now. Look at it right there in the green leaf. Bibiansa sign. Why? Mamunsru. Yep, rocks watch it. The watch in a jar, that's a specialist. Jar Yep. We got a huge contract. This is for hotels and folks from out of town. Yep. Mamunsru. Environmentally friendly. Stays hot. I got to plastic. I gotta go. But this is not for you. I mean, you got a choice, but your choice, your watch stays the same. It's Mamunsru. Rocks watchy. The original is there. In the second demo. Yep. Powder for Fukramudi, so. Hey, who's that? Anyway, we open right now. It's lunchtime. The number to call is 0244-676742, 0244-797911. Rocks watch it to the world. Catch them and see a final World Cup. Yes, yeah, do be able to do.
Are you looking for photography service for your upcoming event? Is it a wedding, an engagement, or a special event? Look no further. Jojo Texan Images is here. Hire him today for great quality pictures, a quality service provided on the day, and a great personality. Jojo Texan Images is on social media. Follow him Instagram and Facebook at Jojo Texan Images or call him 312-450-5235 and book your appointments today. Jojo Texan Images. Simply excellent. Book him now.
My guys, I want to discuss some 7 things where people they talk about Corona plus you.
You put the worry. You don't know say Corona really kill black people.
Make you no make anybody lie you. Corona no dislike if anybody cry. True say it start for China, but right there, it catch everywhere. Where they fit kill anybody, especially people where they get some other sickness. For places like Yankee, Corona they kill black people pass. Yeah, Charlie. Some people say they talk say China people with Enshara do am, or it be 5G self where they cause them. But shine your eye, it no be anybody do am. We 5G to no go fit cause the sickness. The 5G self, it dey like the 4G way we all they take browse ready. It just be upgrade. People too they talk say if you get Corona with chop plain, take garlic, onion, ginger and lime, the sickness go go. But this one too be lie. This thing's good for the body, mom, but I don't know if it prevent or cure Corona.
So what about Sobolo?
Me self, I dey like Sobolo, but into no they do Corona nothing.
Appeal to
Corona mainly they attack the lungs, so appeal no go fit do am nothing. The truth be say, people wey dem dey booze, Corona they feel worry them, papa. People too, they talk say, if you cut onions, put your room, corona no will come there. But corona no they like mosquito, where go fake kill and plus coil.
Then how we go feel protect on our body?
Corona they spread where more people self get, where they no. So Charlie, if you no get anywhere important go, make you day house. But if you really for come out, then you for wear mask, then stay at least 2 meters away from other people. If they wash your hands, then use hand sanitizer more times. But I beg, make you no drink them. If you dey call for sneeze too, do for your elbow inside. Take some bleach to clean surfaces where they touch. But this no be for your body. Finally, if you feel say get corona, may go chop for one corner, so say no go spread them. If you get plenty rest, then drink more fluids. But if you dey make worse, then for call the emergency numbers. Charlie, this be all for today. But if I hear any other thing, I will come back to talk about them. For now, we will make sure say we go protect we, one our family, one our friends, then everybody from corona. We all for play one part, so say we no go increase the pressure where it dey on a healthcare system and on a healthcare professionals them at all.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Hello, viewers, and welcome to the health segment on Trend Africa TV. I am your host, EMPRESS MAWUSI, and I am joined here by Dr. AWAH, Dr. OFORI, and the beautiful Mrs. EUNICE CROMWELL. Dr. AWAH, a viewer has a question for you. John Latte Asem is asking, Dr. AWAH, wondering if there's anything like a mild COVID-19. I heard people saying they had a mild COVID-19 infection. Thanks.
Yeah, as I was saying earlier, in Ghana, well, in general, COVID infection does not take you to the hospital. It usually pass away. Only a small percentage of people get sick to be taken to the hospital. So most people in Ghana is mild, right? Most people don't even know they have it. And I know we're not testing enough in Ghana, but I believe that people just have headache and fevers and chills, and it's not tested, but they have COVID, right? But they're not dying.
Right.
So luckily, we're not dying. So a lot of people in Ghana have mild COVID, right?
COVID.
And it's mild because the symptoms are mild, right? You have it, but you're not expressing the whole florid of disease,
right?
Because your immune system is strong, right? So I think most people are having mild disease, only a small percentage need to be hospitalized, right? So it's a mild disease in Ghana.
So you don't think Sobolo is making it mild?
Sobolo. Oh my God. No. I think our immune system. That's it. Immune system.
So that's our let's talk about your safety going into other people's houses. Is it safe for you and your workers?
I assume that anybody I see has COVID, right? That's my assumption. So I go in and I wear my N95 mask, I wear my lab coats, and I wear gloves. And I have my sanitizer spray on my stethoscope, on my blood pressure machine, everywhere. I spray. So I assume everyone has COVID. And when I come home, I remove my lab coat straight into the washing machine and I sanitize everywhere I touch. So prepare. Good thing is that it's a mild disease in Ghana and most people will not die from it. So I hope I will be fine.
That's all. Actually, some of us have been entertaining the idea of moving back to Ghana to bring changes into our communities. You want to go give back into our communities. And right now, I would say I feel encouraged. I mean, knowing you going back there and telling us, because I'm scared if I get to Ghana, I might die, because of the healthcare system. And I really feel encouraged right now. Do you plan on staying there longer, and how are you Are you going to be expanding your business? What's the plan?
I should have been in Ghana 10 years ago. I
Wow.
came too late. Yes, 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 yes. There's a lot that we can do to help. When I came first, I wanted to go and teach in a medical school, and then I was a bit frustrated, and I am lucky that I was frustrated because setting up this medical practice, opened so many doors, for me in the practice, and it's just amazing. People are calling me to come and help them set up their hospitals, improve the hospital infrastructure, healthcare delivery. So I'm now a consultant for some hospitals, and to just trying to bring them up to speed and up to standard that internationally is required of hospitals. So we should come home and help, because we can talk about it, but if we don't come and tell them what to do, they don't know what to do, right? So if you want to come to Ghana, oh my God, please do come. There's a lot of opportunity for all of us, to come and contribute to the healthcare system in Ghana. Yes.
So how can someone get in touch with you, Dr. Awal, if we want to patronize your services or we want your services? How can we get in touch with you?
Yeah, we have a website, mobiledoctors.net, that you can go in and send us a request to be seen, or there are some numbers that you can call the office. And my personal number is also there. It's 050-552-5507, 050-552-5507. But you can go on our website and all our numbers are there. And then you can send us email, you can call us, and we'll be able to attend to you wherever you are in the country.
That's how. Is the government acknowledging you? Do you have any collaboration with the government?
No, we actually are collaborating with 37 military hospital. They want our services because some of their patients that are discharged, like stroke patients, they can't come and follow up. Reach Hospital is talking to us about collaborating because they cannot discharge the patient home. They don't come back. So we are working with Kolebu as well. So in that terms, yes, we are having some strong collaboration with some of the big institutions to follow on patients who cannot come back for follow-up. Yeah.
Okay, go ahead, doctor.
The healthcare in Ghana, is regulated, right, by HEFRA. So we are accredited by HEFRA. So once you are accredited, then the insurance companies will recognize you, the hospitals will recognize you to work with you. So we are accredited.
Okay. Actually, the CEO of Trend Africa TV's father is also Dr. Asamoah, which we can also maybe connect you with so that you can. I don't know if you've heard about him. Have you heard about him?
No.
Oh, okay. So he was also the contact person with Akufo-Addo when coronavirus first started. He was sorting for advice from him. I think he worked with WHO. EUNICE, am I right?
I believe so. I believe he's the director of WHO.
Okay, yeah, but I think he's retired now.
Yeah, former director. Excuse me.
Okay, yeah. So maybe we might also hook you up. Do you have any question for us, Dr. Awal, before we let you go? And what is your last word for our viewers?
Oh, I want everyone to stay safe. Coronavirus is a real disease, and if you have to be able to, follow up all the guidelines that will prevent you from catching it. if you catch it, most of the time, most likely you'll be fine, but try not to catch it. So I want everybody to obey those rules, social distancing, wearing all the PPEs where appropriate, hand washing. So those are the things that I want people to be aware that you can catch it. And it's very easy to catch it, you know, but try not to do it. And if you catch it, make sure you stay home and don't give it to any other person. So I wish everybody well, and hopefully I will see you guys in Ghana to come and help me to build Ghana.
Definitely, definitely. Do any of you have any questions for Dr. AWAH before we let him go backstage? Okay, I guess not.
No questions.
So,
I just want to say
okay, no
thank you,
questions.
Dr. AWAH, for coming. Thank you for honoring our invitation. Thank you.
Okay, thanks for inviting me.
So that's how don't go too far though. You could be answering some of the questions people have in the comment section, and also if you could post your information for people to get in touch with you, we would really appreciate that.
I'll hang around.
Okay, thank you.
Okay, bye.
Thank you.
So Dr. OFORI, I wanted to ask you, what how did you come up with that concept? Dr. OFORI. Okay, viewers, we'll take a little break and we'll be right back.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion, and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
Hello viewers and welcome back to the health segment on Trend Africa TV. I am your host, EMPRESS MAWUSI, and I'm joined by Dr. OFORI and Mrs. EUNICE CROMWELL. Dr. AWAH was with us for some time, but he's also backstage still answering questions. Right now we want to, Dr. OFORI, are you there? Dr. OFORI, are you there?
Yeah, I can barely hear you.
Oh, okay. Mrs. EUNICE, can you hear me?
All right, I hear you now. I
can hear you, yes.
Oh, okay. So Dr. OFORI, I was talking about the commercial. How did you come up with that concept?
You mean the animation?
The animation, yes.
Yeah, so we figured we wanted to reach out to a lot of people, but we wanted the message to be a little, how do I say, to the layperson, right? And also appeal to younger people. We came out with trying to figure out ways and means to engage people. And we figured that Pidgin is a language that is spoken mostly in Ghana by young population and even some older people. So we decided to have some recording, and we learned the software that we use for the animation. It's pretty tough. We had to spend sleepless nights to put all of that together. We are coming up with another video in a few days that focuses on treatment, and I want viewers to watch out for that video as well. It's just basically trying to put all the things that we've gathered so far, the myths, into one video to be able to reach out people. So it's something that we've been doing behind the scenes to educate people about COVID-19.
So what should our viewers continue to do, that Ofori? What are we doing right and what are we doing wrong and what should we continue to do?
So far we realized that wearing the mask is something that really kind of helped us reduce the number of cases. Initially, we were trying to discourage people from wearing the mask, which was again, this is a new virus, so there's going to be a lot of trials and errors here and there. Whoever knew dexamethasone could save those lives, right? So as time goes on, we're going to learn a lot about this disease. And this is not going to be the first time that we're going to have something like this, possibly in our lifetime. So I think that washing our hands, wearing the mask when we're supposed to, and wearing it properly, which is something that I want to advocate, that we wear it and wear it well. There is no need for a seatbelt if you just pretty much have it across your shoulder if you don't put it on, right? It's good to wear it. Don't remove it when you're speaking. All things that I encourage people to prevent the spread of the virus. Hopefully, we can cut down the numbers drastically. What I was scared of is that the numbers were rising due to the protest, and I was kind of getting worried that a lot of our people that are protesting are vulnerable. The Black population, especially in America, is very susceptible to the infection. So we being out there kind of predisposes to the virus at a higher risk than other people. But so far, the numbers are not that bad, and we expect people to still keep doing what we're doing.
Right. Dr. Ofori, so still you are saying there's no cure for coronavirus and there's no medication we can be taking?
Yes, that's accurate. We don't have any treatment for COVID-19. And one thing I should put out there is that a lot of viral infections, we don't really have like a kind of a treatment. And when we do have it, you have to take it for a very long period of time. You can look at hepatitis treatment and things like that. It usually drags for a longer period of time. Part of the reason is that the viral infection takes over your cell machinery, and that kind of becomes very difficult to target a lot of the cases. So looking at how COVID spreads and the fact that it actually produces what we call cytokine storm, which is very severe inflammatory condition, it makes it very difficult to treat, especially people that experience severe cases. And like Dr. AWAH mentioned, the number of people that have severe cases is very small, but that accounts for a lot of the fatality or the morbidity associated with the disease. So we will say that yes, there's no treatment, but a lot of people that get the infection recover. The standard of care has been giving some kind of antipyretics, and in some cases we tried hydroxychloroquine, which is not working anymore. So there's been a lot of trial and errors, and recently, about 2 days ago, we had a new emergence, which is dexamethasone as a treatment for people that are having severe cases of infections, which is a study coming from UK. So these are all things that are going to change as time goes on, and the conversation is always going to be told as in when the moment of. We cannot compare to the past. This is an evolving condition, and I think so far we don't have a treatment, but there's something coming in the pipeline.
Have you heard about the new spring of virus that has sprung up, the phase of virus that has sprung up in China, and parts of China have been shut down again? What's going on?
Yeah, I did read a bit about that. There's this super coronavirus coming up again, and people are getting scared. I haven't read much about whether it's a mutated form of the coronavirus or is the same virus that is spreading, because they relaxed the rules, right? So if you relax the restrictions, it's quite natural that the infection rate will go up, unless you have absolute control over the virus where there's no spread. Other than that, the numbers is expected to go up, right? So I will urge people to still keep doing what we're doing. Social distance, wear your mask. We've seen that this is the only measure that we can have at this point. So I will still encourage to do whatever we're doing and not be too scared or alarmed about a new sort of coronavirus.
Active in the community, you are educating a lot. Are there other things you're doing to help the community here in Illinois? What other plans do you have up your sleeves?
Okay, so as this goes on, we try to keep education as the right. Even when we do have a vaccine, I think we have a huge task of trying to convince the average person on the street to go for the vaccine, right? So I think education is my major key. Try to educate as much as you can, explain it to people, because some people even think they've never taken a vaccine before, right? And they have the yellow card and they came to America with that yellow card.
Right.
So it's just the education piece of it. So if you look at how people perceive, and sometimes some of the things I read online, I wonder maybe I shouldn't have been in the lab all my life, because there's a disconnect between what I'm doing in the lab or what I'm doing and the person that I'm doing it for.
Right.
So most of the time, researchers, we go to conferences, medics, we go to conferences, and we don't really invite a lay person, right? We go there and sit there and make all these, treatment modalities and all of that. But sometimes we fail to capture the person we're designing it for, right? So I think this is a time that we try to seek the input of the lay person to inform what we are doing in the research, in the clinic, and things like that. So I think what I have is that, and I think EUNICE and Dr. AWAH and all the other people and yourself will agree that we need to do the education as much as, and that's what we're doing right now. So we need to intensify it, put the wording out there. It's like marketing, pretty much. We need to market science. We need to market health, because people in Ghana don't even want to go to the clinic because they think it's too expensive. Right? They think you only go to the hospital only when you're sick. Right. And we've realized that actually is down our age, our lifespan drastically. So these are all things that we need to do and break it down. I believe in that. You break everything down to the person's understanding that this is going to help you in the long run. And when you do that, you tend to win a lot of souls.
Right. You were talking about the yellow card, Dr. OFORI, where I remember even when you get a visa and you're coming to America, because you are so eager to get to America, when they tell you you don't have this vaccine, you have to take it before you can be allowed to go to America, and you're like, just give it to me. Should that is that going to be is that going to be the next norm at the? It's likely it's going to be the next norm at the airport, where, because people might say, I'm not going to take the vaccine, but once you get the visa and you get to the airport and they're like, if you don't take this vaccine, you're not going to America. They're like, just give it. Anything you have, just give it to me. Maybe that will be the next norm.
So people are calling that, they're calling that the COVID passport. So it's going to be in a case where you're going to have the COVID passport. Wow. If you don't have that, certain countries will not allow you in. And I know America is probably going to be one of them. This disease has really hit America really hard.
Yes.
And the same way they did with 9/11, I don't think they will slack anymore.
Right.
So it's going to be a lot of restrictions on travel going forward. But what we should not forget is that this is not going to be the last time. Maybe we will learn a lesson out of it. Maybe we will not. The lesson we should learn is that we should always plan for the unthinkable, which is one little virus can shut down the whole world.
Yes.
See, one thing I said somewhere, and I want to repeat here, is that we're lucky. You know why we're lucky? Because this virus is not as lethal like Ebola or some kind of
Hold on.
other
Someone is
viruses
saying
that
no
kill you.
sound. Is it okay now? Can you hear me, everyone?
Yeah, I hear you.
Okay. All right. Go ahead, doctor. I'm sorry.
Okay. So what I was saying is that we are lucky that we have a virus that the fatality rate is like really low, right? If we do have a virus that spreads like COVID and also
Right.
kills as fast as Ebola, we're in deep
Right.
trouble, right? So I think the understanding is that we should plan for that in the future, where the disease spreads very fast and also kills a lot of people. Like fatality rate is like 90 something percent. Then we have a real case in hand. But again, there's no treatment. Prevention is the key. Make sure that you stick to whatever your authorities are saying. If you have to stay home, you stay home till we find a vaccine and we go from there.
Mrs. Eunice CROMWELL, are you there?
I'm here.
Yeah, I know you're already very active in the community. What is the Ghana National Council still doing, and what are the plans now? What is going on, and how can we help?
Well, Ghana National Council is still here to support as much as possible. We're just a really big resource center. Anything that we find out, whether it's from the government level or even a local level, we are sharing that information amongst all the affiliates so they can be able to tell their different community members and share it amongst churches. So that's where we are right now. And then, of course, partnering with Trend Africa TV to be able to bring this program every other Thursday is just very important. I believe in education, and I think that people who don't want to seek education, you are lacking a lot of things because not everyone knows everything. So it's beneficial for you to tune in every other Thursday. Maybe there's something that you've really been wanting to know and you haven't had a chance to ask your provider or ask someone. This would be the format that you can ask. And even if we're not able to answer it right away, everyone here believes in research. So I'm pretty sure that we'd all be able to find the answer and be able to get back to you. So I encourage all of us that this show is here to promote and to help. And like the topic says, COVID-19, the way forward, because this is something that we have to learn how to live through. Dr. AWAH was speaking how people in Ghana are taking it like a flu. I don't know when in America we're going to be able to get to the point where we can look at it like a flu, but we still have to know that this is something that is around. We need to find effective ways to live through it, because it's going to be something that's going to be around for a while. I heard on the news that at least for the next 18 months. So what do we do in the next 18 months? We have to learn how to keep ourselves safe. We need to learn the essential things we need to keep in our home, making sure that we're sanitizing everything. And a lot of people are saying that we're going to learn a lot from it. If nothing at all, I think people have learned how to be more clean from this whole thing. Because if you can recall before, a lot of people, you find people were not really doing things that were sanitary, and because you weren't really getting sick or you weren't really seeing an effect of it, you didn't care. But right now, as we are seeing that young people who are working in the hospital, people who you would never expect to get sick. I saw a devastating story about a Ghanaian nurse that passed away. She was working in the emergency room and she was very pregnant, and they were able to save the baby, but not her. And her husband was just, he was so devastated talking. And you think about all the people that are risking their lives to just make sure they're saving humanity. And some people will say, oh, but they're getting paid. But that doesn't matter, because you can still decide to stay at home and collect unemployment if you're a nurse. You don't have to go to work.
Right.
You don't have to put yourself at risk, as a doctor or a nurse or a pharmacist. So we should just be able to respect our community, respect other people by protecting yourself so that you don't get other people sick. That's what we really need to do.
All right. Viewers, don't touch that dial. We'll be right back. We'll take a little break and then we'll be rounding up.
To advertise with us, donate sponsorships and suggestions, email us.
Hi, my name is Ochiame Kwame, the rap doctor. Coronavirus is a stubborn one, and because of this small virus, the whole world is on lockdown. But hey, hope is not lost. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctors. They will send a doctor to your home, send a fleb to come and take your blood sample,
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they'll give you an amazing discount. Mobile Doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile Doctors, the doctors in your home.
My guys, I want to discuss some 7 things where people they talk about Corona plus you.
You put the worry. You don't say Corona really kill black people.
Make you not make anybody lie you. Corona no dislike give anybody crap. True say it start for China, but right here, it catch everywhere where they feel kill anybody, especially people where they get some other sickness. For places like Yankee, Corona they kill black people pass. Yeah, Charlie. Some people say they talk say China people wouldn't share do or it be 5G self where they cause them. But shine your eye, it no be anybody do we 5G too no go fit cause the sickness. The 5G self, it dey like the 4G way we all they take browse righty. It just be upgrade. People too they talk say if you get Corona we chop plain, take garlic, onion, ginger and lime, the sickness go. But this one too be lie. This thing's good for the body, mom, but I don't know if it prevent or cure Corona.
So what about Sobolo?
Me self, I dey like Sobolo, but him too no they do Corona nothing.
Appeal to
Corona mainly they attack the lungs, so appeal no go fit do am nothing. The truth be say, people wey dem dey booze, Corona they feel worry them papa. People too they talk say if you cut onions put your room, Corona no go come there. But Corona no they like mosquito, where go fit kill am plus coil.
Then how we go feel protect on our body?
Corona they spread where more people self get, where they no know. So Charlie, if you no get anywhere important go, make you dey house. But if you really for come out, then you for wear mask, then stay at least 2 meters away from other people. If they wash your hands, then use hand sanitizer more times. But I beg, make you no drink them. If you dey call for sneeze too, do for your elbow inside. Take some bleach to clean surfaces where they touch. But this no be for your body. Finally, if you feel say get Corona, may go chop for one corner, so say no go spread them. If you get plenty rest, then drink more fluids. But if they make worse, then for call the emergency numbers. Charlie, this be all for today. But if I hear any other thing, I will come back to talk about them. For now, if we make sure say we go protect we, one our family, one our friends, then everybody from Corona. We all for play one apart, so say we no go increase the pressure where it dey on a healthcare system and on a healthcare professionals them at all.
It's here for Mechiamo God's afternoon. Yes, fellow Ghanaians, this is a public service announcement. No need to get excited. Your watch it stays the same. It's in the brown box now. Look at it right there in the green leaf. Beyonce sign. Why? Mamusru. Yep, rocks watch it. The watch in a jar, that's a specialist. Jar, you see, yep. We got a huge contract. This is for hotels and folks from out of town. Yep. Mamusru. Environmentally friendly. Stays hot. I got a plastic. I gotta go. But this is not for you. I mean, you got a choice, but your choice, your watch it stays the same. It's Mamusru. Rocks watch it. The original is there. In the second demo. Yep. Powder for Fukramudi, so. Hey, who's that? Anyway, we open right now. It's lunchtime. The number to call is 0244-676742, 0244-797911. Rocks watch it to the world. Catch them and see a fan World Cup. Yes, yeah, do be a bit paiju.
Are you looking for photography service for your upcoming event? Is it a wedding, an engagement, or a special event? Look no further. Jojo Texan Images is here. Hire him today for great quality pictures, a quality service provided on the day, and a great personality. Jojo Texan Images is on social media. Follow him Instagram and Facebook at Jojo Texan Images or call him 312-450-5235 and book your appointments today. Jojo Texan Images. Simply excellent. Book him now.
Hello everyone and welcome to the health segment on Trend Africa TV. I am your host, Empress MAWUSI. I would like to acknowledge some viewers. Cynthia AJ Pond, thanks for joining us. Kaiser Driver says great information. Raphael Kwao, Pastor Raphael Kwao, thanks for watching. Senna Hetty, where's on low? You're watching us. Dr. Ofori, I want to ask you, after speaking to Dr. Awa, are you inspired to go back to Ghana and work with him, or probably start something like that?
Yeah, sure. So it's a very good thing that I think one of my friends also is looking at it currently, and we are working with him to get those kind of animations to get a message out there, and very soon I think it's a business that's going to really spread everywhere in Ghana, to provide some kind of health services to them. One thing I was thinking about whilst they were talking is that they can partner with a lot of pharmacies, because there's so many pharmacies in Ghana. And when I was practicing in Ghana, we kind of were the first point of contact. I would say that's the emergency point. It's not like here in America where everything has to go through the emergency room. There were a lot of diseases that were treated by the pharmacist. So looking at this, we can kind of team up, the doctors and the pharmacists can team up and have a mini clinic in these pharmacies, and that kind of catch a lot of these preventative care and things like that. So once they're working with the hospitals, I will urge that we also look at teaming up with the pharmacists and the nurses in the community to provide community care, because in Ghana, when someone is sick, the first thing is I got to go to the pharmacy. So part of the reason is that when they go to the hospital, the wait time is really, really long.
Right.
And they will think about which one is the best. So we can put our clinicians in the pharmacies, have a mini clinic there, and we can catch up these issues.
Wow. What an awesome idea. I was just about to talk about that. Would be so awesome. Because when we were in Ghana, even when we go to the pharmacy, we tell the pharmacist what we want to buy. We they're like, what do you want to buy? We're like, okay, I want this, I want that. It's like we self-treat ourselves.
It's like a shop.
Yeah, exactly. So I mean, this is so inspiring. Mrs. Eunice, are you inspired after talking to Dr. Awa? Are you inspired to go back to Ghana and do something? And what are you thinking? What can we do?
Yes, Dr. Awa is a brilliant physician. He's actually my mentor.
We can't hear you.
I'm sorry. Can you hear me now?
We can't hear her.
Hello?
Okay. Go ahead. Keep talking, Mrs. Eunice. I think they can hear you. I'm the only one that can hear you.
Oh, okay. Okay. No, Dr. Awa is a brilliant physician. He's actually one of my mentors, so I'm very honored to have him speaking today. And yes, my ultimate goal is to be able to move back to Ghana and really promote change for the healthcare system. That is one reason why I like to surround myself with different people, get different ideas, and you learn from different people. That's just my motto. So definitely one day you'll see me in Ghana, and I will be definitely promoting change and driving evidence-based practice and really changing it, because I want for everyone in Ghana to be able to receive good health care, and we need to extend people need to live longer. Like, we need to enjoy our lives, and people there need to enjoy too. So it's very, very important and top priority for me.
Hello, Dr. Ofori. Eunice, can you hear me?
Yes, we can hear.
Okay, good. I can hear you too now. Okay, so what is your last remark, Mrs. Eunice, before we bring things to an end?
Well, I'm happy that everybody was able to tune in. I hope that people have learned a lot of things. If there were questions that you could not get answered today, I encourage you to please post your questions so we can go back at the end and be able to answer your questions, and also provide resources where you can get more information. Of course, always stay tuned to this station. Lots of informative information. And look out for better things. There's a lot of good things coming out of everybody, and I want everybody to just be healthy, be safe, and have a wonderful evening.
Thank you, Mrs. Eunice. Dr. OFORI, over to you.
Yeah. Hello?
Yeah, over to you, Dr. OFORI. I can hear you.
Okay. Okay, great. So what I would say is that, yeah, COVID is here to stay. We thought it was gonna, fizzle out, but it's not. It's actually done a lot of damage. One thing I would like to share before we leave is that when it comes to treatment, so far, some people have already started mentioning dexamethasone, and I wanted to let our listeners know that it's not something that you can take to prevent the infection, and therefore I don't want people to rush the same way they did with hydroxychloroquine to take some of these steroids. As you know, steroids are immunosuppressants. So we don't advocate that people just go out there and just purchase them. You can have some serious side effects with that, fluid retention and things like that. Also, the study, even though it's a very good study, we still haven't had a chance to review the whole data to be able to see what is actually in that study. But it's good news that it's a medication that actually improves the quality of life or saves some people's life who are like critically ill from the virus. So I would say that keep doing what you're doing, wear the mask, do social distance, don't go to places that are crowded, and stay safe. In that way, you prevent an infection in the first place. And thanks for listening.
Thank you, Dr. OFORI. Kwesi Sam is saying, thank you all for doing this. Watch it for you next week. So we should be expecting some watch it delivery next week. So thanks to Mr. Kwesi Sam. He is the president of the Ghana National Council. We thank you so much, Kwesi Sam, for all the support. Right now, I'd like to use this opportunity to thank our viewers, Omama TV, Holiday Africa TV, Powerhouse Media and Restaurants, Akese Skylines Fashion, Medus Designs, Odinuhun Design, and we also want to thank the Ghana National Council. Viewers, as you all know, we are doing this program out of our heart. All of us professionals, we could be somewhere making money, but we've decided to dedicate this time to educate our community, and we are trying to change the world in every little way we can, starting from ourselves and maybe the community and our neighborhood. So this is an opportunity to collaborate with Trend Africa TV. Please subscribe, like our pages, follow us on Facebook, subscribe on YouTube. We need to get our numbers up so we can get the message to a bigger crowd. And then if you want to also advertise on these programs, please contact us, email us, and call us on 773-312-0318, or you can email us at trendafricatv@gmail.com. Or if you even just want to send us some, a little token, donate a little token to us too. We have Cash App, Zelle, and all that. Just call us and then we'll give you the information. Those who have already donated, we thank you so much and God bless you. Right now, I am going to bring the program to an end, and I hope to see you guys all here in 2 weeks again. Until then, be safe. Trend Africa to the...
Yo, what's up, boy? This be your boy Agbeshide Nanya, aka Ewa Gang Boss, aka Mr. Roro. Right now, I'm live on Trans Africa TV. Keep it locked, don't touch it. Ewa Gang Boss. 1 year second.
What's up? I go by the name of Mo Beats Banger, and you're watching Trend Africa TV. You dig?
What it do, my people? It's your boy Kingsley Ego B, aka King the Preacher. aka the peacemaker, aka the joy of the people, is my peace of mind. You are now watching Trend Africa. Don't touch that dial. If you won't touch her. Come on there. Keep watching Trend Africa. We are here. Africa has come to stay. Don't touch that dial. One love. Keep watching. Ratata.
Wagwan, people of the world, I go by the name Mafia, aka Young Bass. And I'm representing right now for Trend Africa TV with your one and only Royal Black Jesus. Watch Trend Africa TV this and every Wednesday live on Facebook. You see what I'm talking about? I'm a so. Bless up.
Hi, my name is Ochiame Kwame the Rap Doctor. Coronavirus is a stubborn one, and because of this small virus, the whole world is on lockdown. But hey, hope is not lost. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctors. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they will give you an amazing discount. Mobile doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net.
My guys, I want to discuss some 7 things where people they talk about Corona plus you.
You put the worry. You don't say Corona really kill black people.
Make you no make anybody lie you. Corona no dislike give anybody crap. True say it start for China, but right here, it catch everywhere where they fit kill anybody, especially people where they get some other sickness. For places like Yankee, Corona they kill black people pass. Yeah, Charlie, some people say they talk say China people with shada do am, or it be 5G self where they cause them. But shine your eye, it no be anybody do am. We 5G to no go fit cause the sickness. The 5G self, it dey like the 4G where we all they take browse righty, it just be upgrade. People too they talk say if you get corona with chop plain, take garlic, onion, ginger and lime, the sickness go. But this one too be lie. This thing's good for the body, mom, but I don't know if it prevent or cure corona.
So what about Sobolo?
Me self, I dey like Sobolo, but into no they do corona nothing.
Appeal to
Corona mainly they attack the lungs, so appeal no go fit do am nothing. The truth be say, people wey dem dey booze, corona they feel worried them papa. People too they talk say if you cut onions put your room, corona no go come there. But corona no they like mosquito, where you go fit kill am plus coil.
Then how we go feel protect on our body?
Corona they spread where more people self get, where they no know. So Charlie, if you no get anywhere important go, make you dey house. But if you really for come out, then you for wear mask, then stay at least 2 meters away from other people. If they wash your hands, then use hand sanitizer more times. But I beg, make you no drink am. If you dey call for sneeze too, do for your elbow inside. Take some bleach to clean surfaces where they touch. But this no be for your body. Finally, if you feel say you get corona, make you go chop for one corner, so say no go spread am. If you get plenty rest, then drink more fluids. But if you make worse, then for call the emergency numbers. Charlie, this be all for today. But if I hear any other thing, I will come back to talk about them. For now, you for make sure say we go protect we, one our family, one our friends, then everybody from corona. We all for play one part, so say we no go increase the pressure where it dey on a healthcare system and on a healthcare professionals them at all.
It's here for Mechiamo, God's afternoon. Yes, fellow Ghanaians, this is a public service announcement. No need to get excited. Your watch it stays the same. It's in the brown box now. Look at it right there in the green leaf. Beyonce sign. Why? Mamusru. Yep, rocks watch it. The watch in a jar, that's a specialist. Jar, you see, yep. We got a huge contract. This is for hotels and folks from out of town. Yep. Mamusru. Environmentally friendly. Stays hot. I got a plastic. I gotta go. But this is not for you. I mean, you got a choice, but your choice, your watch it stays the same. It's Mamusru. Rocks watch it. The original is there. In the second demo. Yep. Powder for so. Hey, who's that? Anyway, we open right now. It's lunchtime. The number to call is 0244-676742, 0244-797911. Rocks watch it to the world. Catch them and see a fun World Cup. Yes, yeah, do be a bit do.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.